Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and I'm going to show you a Vaser Liposuction procedure today. This is for a patient's arms, and she just felt like this was an area that was very stubborn for her, and she wasn't able to get rid of the fat so easily. It kind of runs in the family to some degree. So what I did first is numb the skin, and then the second step is to actually liquefy the fat. And here I'm using the Vaser technology, which uses high intensity focused ultrasound, and it just breaks apart those fat cells. And you can see kind of this creamy liquid pouring out of the little puncture points that I have made. And that is actually the fat coming out. There's very minimal to no bleeding with this. It spares the blood vessels, it spares the nerves. So it's a very gentle way to actually more completely remove the fat. And also in the process, we get a little bit better skin tightening and contraction as well, partly due to the heat of the ultrasound, but also the gentleness of the procedure in preserving the tissue, and then also just a faster healing time because there's less bruising, less swelling in general with this procedure. So I am still here on the first arm, melting the fat and now suctioning it out, and then you can see that fat going into the plastic tubing and into the canister. And it's of course extremely gratifying to see all that fat leave the body and go into the canister, and the results are fairly immediate. So it's one of my favorite procedures in that sense because it's just really immediate gratification. And then we're moving to the other arm now, where this is the numbing, a tiny little puncture. And those little punctures close up within usually 48 to 72 hours once the leaking stops. So there is usually a bit of leaking in the beginning of some of the numbing medicine, fat, and so on that continues to leak, and that stops within 48 to 72 hours. We do ask patients to wear their compression garment continuously for that time. Then you can shower, but then continue to wear the compression garment for roughly another month or so to allow everything to heal up nicely. So here I am just doing the tumescent anesthesia, numbing everything up. Once it's numb, you don't feel the procedure at all, and you can see all that beautiful creamy fat just leaking out of the area. And again, it's just really gratifying, and you don't really see any blood at all. So just nice creamy fat coming out, and then we'll suction it out and make a big impact for this patient. She has a wedding coming up, so she wants to look good in her dress. And I recommend that you do the procedure at least a month or 2 or 3 even before a special event in your life. But you know, we have other procedures such as cool sculpting and sculpture, and even M-sculpt and all of that, and they work well, but nothing like liposuction to really just get that fat out more immediately. And there you can see the canisters just filling up. We got about 500 mLs of fat from each arm, so in total about a liter of fat. And she is going to have just an absolutely amazing, very beautiful result from this procedure. So here I am just continuing to remove the fat and kind of mold the area. Really like to shape it out and give patients a nice shape when it's all done. So there's the fat, and that is the end of the procedure. Thank you so much for watching.